Anytime a new technology is implemented, questions arise on how best to explain the technology to the patient. Provisor is no exception, but here are some simple scripts that you may find useful in optimizing the benefit both the practice and the patient will receive from Provisor technology. If you'd like to download a text copy of these scripts, you'll see a link in the download section of Provisor University. In far too many practices, patients with periodontitis may be receiving care that is largely appropriate for their needs, but they have never been told that they actually have a disease requiring more specific treatment. Since every patient with perio will be correctly identified by Provisor, the first thing to do is to tell the patient that they have a disease and that the disease requires treatment. If patients don't receive this kind of clear communication, they can't be expected to understand the value of your excellent professional services. In addition, patients with periodontitis who haven't been formally diagnosed with perio, even if you're providing treatment, won't be as compliant with home care instructions, recall frequency, or case acceptance as might be optimum for improving their health. If you do nothing else, just tell every patient with periodontitis that they have the disease as identified with Provisor. The Provisor report has a lot of information, including risk and disease scores, treatment interventions, and more. Don't worry about explaining in detail what is on the report. Patients receive scores in so many other areas of their life, for example, cholesterol levels or blood pressure, body weight, and others, that Provisor's oral health scores make intuitive sense to them. If you comment briefly on the meaning of the risk and severity scores, the patients will get the information they need to be motivated to participate fully in improving their health. The important information on the patient report is the individualized risk and disease scores. Explain to the patient that the risk score is the probability that without appropriate treatment, the disease severity score will worsen. Put another way, the risk score is a view of the future, while the disease score is quantification of their current health state. The end point of periodontitis is tooth loss. Sometimes it's helpful to show a reluctant patient how their Provisor risk score may translate into tooth loss if the recommended active therapy isn't accepted. Data published in 2003 quantifies the relationship between tooth loss rates and Provisor risk scores when no active perio therapy is done. Based on this research, even a low Provisor risk of 2 will result in a loss of 3% of total dentition unless active therapy is accepted. With a very high Provisor risk of 5, fully 23% of teeth were lost over 15 years when patients with periodontitis did not receive active therapy. If you'd like a copy of this graph to use as an aid to communication to patients, you can download a copy from the download section of Provisor University. Since Provisor will identify all patients with periodontitis, the question naturally comes up on how to talk to patients that you may have been treating appropriately but have never been formally diagnosed with the disease. This worries clinicians a lot more than it worries patients. Patients are routinely exposed to changing medical recommendations based on new research. For example, blood pressure levels today that represent hypertension might not have been considered too high 10 years ago. If you have a patient with perio not previously diagnosed, simply tell them the truth. New research has been published implicating gum disease in cardiovascular disease, certain cancers, strokes, the early onset of Alzheimer's, and complications in the treatment of diabetes. As a result, dentistry and your office have newer and tighter standards for measuring and describing periodontal disease. And, based on those new standards, explain to the patient that they have the level of periodontitis described on their patient report. Reassure the patient that with appropriate therapy and ongoing maintenance, their gum disease can be stabilized and they can be maintained without deterioration for a very, very long time. In other words, science has learned new things about gum disease, and your office is on top of the new research and the new tools needed to accurately identify and control oral disease. If expressed this way, your patient's confidence in your skills and care will only increase. Most hygienists have a favored way of describing what periodontitis is, what causes it, and why therapy is needed. This is an important communication because gum disease is largely painless. It can be ignored for a long time if the patient wishes to ignore it. The script above was developed by a panel of hygienists who agreed on a way of describing the disease that will motivate the patient to do something about it. Here's what they came up with. If you're not comfortable with the motivational potential of your own disease description, perhaps you can draw an idea or two from this script.